The following segment is sponsored by HIFU Prostate Services. There is a new minimally invasive treatment for prostate cancer patients. Dr. Stephen Gange is here to tell us all about it. Doctor, welcome to the show.
Thank you very much, Laura.
So let's start off. Why is it so important for men to get a prostate cancer screening?
Prostate cancer is the #1 cancer in men, and it has no symptoms until it spreads. So if we don't check into it early, we might miss it when it's treatable.
So let's talk about HIFU. What is it?
HIFU stands for High Intensity Focused Ultrasound. The best analogy is taking a magnifying glass to the sunlight and burning a leaf. So the focusing of those waves of energy is very similar to what happens with HIFU, although it comes from the patient's rear end. It's a very, very specific and precise treatment to send bullets of energy into the prostate.
Okay, so you've talked about what it does. Who is HIFU for? So who are the best candidates for this?
So it's ideally for men with early curable prostate cancer. Same guys who'd be candidates for surgery or radiation more traditionally.
Okay. All right, there you go.
Yeah, but it offers a lower side effect profile, so fewer sexual side effects, fewer urinary side effects as well.
All right, there you go. So what differentiates it from other treatments? What are some other differences between HIFU and those that most people know?
Well, it does require an anesthetic, and that's similar to surgery, but there's essentially no bleeding and no pain. So patients come through the procedure without having a lot of residual symptoms. They have a catheter, a little tube for a week or two after the procedure, but other than that, it's a very well-tolerated experience for these guys.
All right, so talk to us about your experience with this as a professional. Why are you so supportive of HIFU?
Yeah, it's been around actually quite a while. We started training out of the country in 2009 or 2008 for some of us, and that's because it wasn't yet available in the United States. So 40 countries before our country. And then in about 2015, we were able to move into the US, and now with some new approvals and insurance coverages, HIFU is going to be widely available starting just the beginning of 2023.
Because I was just going to ask you, so you talked about how it's been in other countries, now it's in the US, so it is pretty widely used.
Well, it's interesting because the cost issues have been unresolved. Patients have had to pay a lot of money out of pocket, and that's kept it from becoming more and more popular. But now, as I said, with Medicare coverage starting in 2023, we're going to see a whole lot of folks who've wanted it, who are now able to afford it, if you will.
There you go. Doctor, where are you located so people can come visit you?
I'm part of Summit Urology Group, a large urology group in the Salt Lake area, part of Gange Medical Clinic. My office is in Holiday. And, there's a lot of places in this country where people can get HIFU, but I'm the only HIFU-trained urologist in Utah.
Well, there you go. Doctor, thank you so much for being with us today.
Nice to meet you.